Body, Spirit, the Impact of the Central Nervous System and our Overall Health and Well-Being by Dr. Patricia Kiser. Many studies show that spiritual belief positively affects many health conditions. This talk will discuss the role of the central nervous system in this process and tips on how spirituality can affect your health. Dr. Patricia Kiser was born and raised in San Mateo, California. She has a passion for serving people and witnessing the miracles of chiropractic care. Since she graduated from Palmer College of Chiropractic West in 1994. Since that time, she has built two of the largest chiropractic wellness clinics in California, became a member of the International Chiropractic Association. She has trained several dozens of associates, students, and interns. As a result of her passion for service, teaching, and her dedication for her profession, Dr. Kiser has seen thousands of people get well and stay well under chiropractic care. Please welcome Dr. Kiser.
All right. Well, thanks, Susan, for inviting me here tonight. I'm going to be talking about the nervous system. We're going to go over a number of different points about the nervous system. One thing that I want to talk about is the organ in the body that controls all other organs. So before getting here tonight, Susan told me how intelligent of a crowd this is, so I want to know from you which organ controls all other organs. Who said the brain? Okay, yes, it is the brain. I did the same talk to a group of preschool teachers, and they all said the heart. So I love that because you always want your preschool teachers to be leading with the heart, right? Yeah, it is the brain, and the brain is running the whole show. So in order to understand how the body's working, we want to look at the anatomy here. So the brain, how the body works is the brain sends messages down the spinal cord, and then off of the spinal cord are all these pairs of nerves that go to every organ and every tissue cell in the body. So heart, lungs, liver, kidneys, everything is being controlled by these nerves. This is the wiring. So Dr. Hong talked a lot about cellular levels. What happens on a cellular level? Well, on each cell there are what's called neuroreceptors. So I'm going to be talking about the communication system as it relates to the cells. And so what happens is, as long as the brain is able to send messages down the cord and then off the spinal cord to the organs and tissue cells, the body is said to be at an optimal state of health or an optimal state of function. But unfortunately, there's a condition called vertebral subluxation. So in that first sheet you have in your handouts, the condition of vertebral subluxation is when one or more of these segments go out of position, causing pressure or irritation of the nerve as it exits out through in between the vertebrae. Now, when does this occur? Why does it occur? Well, what is the very first trauma we have in life? Birth, absolutely. And in fact, in chiropractic college 25 years ago, we were required as part of our curriculum to study or to watch videos of the birthing process. And I'll never forget seeing this one doctor delivering this brand new baby with the head of the baby in between his hands, his foot up on the table, and you can literally see his biceps popping. That's how much force he was putting on the cervical spine. So oftentimes what happens is our very first subluxation or misalignment will actually occur at birth. But let's say this didn't happen. Let's say the birth was as non-traumatic as possible. Well, what then happens? We start to crawl, we start to walk, we start to climb, we have falls, we start to play sports, we start to drive, have accidents. All of these traumas happen over a period of time, and what that does is it sets up this process of subluxation, these malpositions. So when you look in your handouts, again, the second page in there shows you at every single level where these nerves are traveling to. If you have a subluxation that occurs up here in the upper cervical spine, can cause dizziness, can cause headaches, can cause problems with the ears, the eyes. If that occurs in the mid to lower cervical spine, these nerves go to the thyroid gland. They go into the shoulders, the hands, the fingers. Someone had mentioned Raynaud's phenomenon. Those nerves that go into the hands and the vascularity of the hands come out from this part of the spine, upper thoracic. When you look at the T2, T3 level, those go to the heart and lungs. So if I cut the nerve going to your heart, how well is your heart going to function? It's not. By itself. Yeah, it's not going to function, right? And so the same thing as we go down the spine, and again on that chart, shows you exactly where every single one of these nerves travel to. So when we look at that and we talk about dis-ease, and we talk about the breakdown, we have to include the central nervous system. This is your body's intelligence. And how does this relate to mindset and spirituality? I'll get into in just a bit. But the reality is that in the West, we call this your body's innate intelligence. Every single thing, every single function is relying on this intelligence. We all have it. The cool thing about it is it's also called the automatic nervous system. So if you just had some snacks, you don't have to tell your stomach how to digest it. Someone said, yes, we do. There's all of these different billions of functions are going on, and we don't have to think about it. And that's a wonderful thing, as long as there are no interruptions in the communication. So what can happen with subluxation, again, caused by physical, chemical, or emotional stress, what can happen then is that nerve irritation, the blockage of your innate intelligence to the organ and tissue cell, which then leads to a breakdown on a cellular level. Cells not getting 100% of communication, what's going to happen? There's going to be confusion. So we talk about all of these things. Relates a lot to what Dr. John said. I don't think I pronounced your name right, I'm sorry. But that it's all connected, right? Everything she's talking about our nutrition, talking about epigenetics, talking about all these different things, the functions, having to nourish ourselves with the right things for our bodies. It's all connected. So we look at that and say, okay, well, we talked about physical stress. What about emotional stress, right? Here's the thing about our autonomic nervous system. It was designed for survival. That means that when we're out hunting and gathering in the jungle before the Whole Foods bar got set up, when we're out hunting and gathering for food and we ran into a giant rhinoceros that came charging at us, what happened? What happened? We had two choices. We could either grab the biggest stick we could find and try to fight it off, or we could take off running as fast as we could in the other direction, right? Let me ask you a question. What happens physiologically in this particular fight or flight reaction? What happens to the blood pressure? Does it go up or down? It goes up. Does respiration become deeper or more shallow? Shallow. Do the muscles relax? No, they contract, right? What about your adrenaline? That spikes. Cortisol, stress hormones, those spike. All of these things that affect us on a cellular level, right? It was for survival. But the reality is that our brains don't always know the difference between a real and imaginary threat. What do I mean by that? Well, stress. right? Do we have stress? And what happens when we have stress, right? We go into fight or flight. And that's what stress is, right? You're driving down the freeway, you know, get into a traffic jam, you're supposed to be on time somewhere, you know you're going to be late. What happens with your breathing? Do you just start deep breathing? You could if you're a little bit more aware and enlightened, but most of the time what happens? Our breathing becomes shallow. Are we tightening up on the steering wheel, or are we just kicking back? No, we're in this stress response, parasympathetic, fight or flight. So what happens is it may not be as acute as in the scenario of this giant rhinoceros chasing us, but it's on a lower level. And generally the type of stress that we have today is on a more chronic low level. So it's not that incredible, but it's this low level fight or flight. Okay, so what happens and how does that relate to everything else? Well, when we look at emotional stress, we're looking at reducing emotional stress. And there's a lot of different ways to do that. So we mentioned earlier meditation. Someone asked about blood pressure. There's tons of studies on meditation and the reduction of blood pressure on a regular basis. Reducing that, reducing the mental noise. Some people call it the monkey mind, right? Being able to reduce that. Now, the thing with something like meditation is it's cumulative. That means that just like going to the gym and you get stronger and more fit by consistency over time, same thing happens with meditation. So that means if you have some sort of daily meditation practice, over time, first time you meditate, especially if you like me and you're thinking a lot, what'll happen is you'll sit down and you go, oh, this is just silly. I should be doing the laundry. I've got 15 other things to be doing. Where are my kids out right now? I got work, blah, 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 and it just keeps going, right? But over time, when you start to be able to let that go and let it go and let it go and let it go, before you know it, you could be in the middle of IKEA and being in a peaceful state. I mean, that's kind of like, I can't stand IKEA. I can't go, it's just one of those places. But anyway, yeah, those are the kinds of things that help to relax things. Now, let me tie it back because everything is related, right? Have you ever tried to meditate with a migraine? Right? It'd be almost impossible. Pain is very consuming. And so that makes it very difficult. So what happens is when we look at the nervous system, what we look at subluxations, what I'm talking about is oftentimes 90% of the nerves are not pain sensitive. That means that they're controlling functions and you're not feeling it. But the 10% pain sensory, what happens if that gets irritated, it creates asymmetrical contraction in the body. I'm back in the physical now. Asymmetrical contraction in the body, and that is what leads to pain, right? Irritation, inflammation. All that, and I'm talking about this specifically. I'm not talking about the systemic inflammation. If you have the systemic inflammation as well, and you have a diet that's high in sugar, and your body's inflamed, that compounds things. So it's all related. What we say when we're talking about taking care of the body overall, we talk about the 5 essentials of health and well-being: mindset, nutrition, sound nervous system, detoxification, and fitness. Exactly the same. Those are the principles to overall health and well-being. But I bring up the subluxation and nerve irritation. One thing is because I'm dealing with that every day, and I have been for 25 years, because I've seen people sick, suffering, and dying as a result of not having an adequate nerve flow. So this is my specialty, but do we also incorporate all this other stuff? Absolutely. So let me talk about this from a spiritual perspective. So when we talk about the innate intelligence, we call that on the west side, in Western medicine, innate intelligence running from the brain down the spinal cord, out the nerves to every tissue, cell, and organ in the body for communication. What do they call this energy information system? What do they call that in the East? Chi. Chi. Life force. There's a lot of other names for it, but it's the exact same thing they're talking about. So when we're talking about, again, when I'm looking at this whole nervous system and I'm looking at the spine from a spiritual perspective, what I'm looking at, very similar but not the same as acupuncturists, I'm looking at the life force as it runs through the body getting blocked by subluxation, which is the malposition irritating the nerve, cutting off the life force, resulting in a symptom or loss of function. In acupuncture, in the meridians, they talk about the same thing again, life force flowing through the meridians. So much of this is overlapped. In science, we're describing what is. And what happens is that as we're looking at it from very similar perspectives, we're just describing it a little bit different. It doesn't matter, it's the same thing. It is the life forces, it is the energy, it is the intelligence. So what we want to do is we want to be able to nurture that intelligence in the body and want to make sure that our spines are free of subluxation. When we look how I approach things in my practice is we do an evaluation. So what do we test? Because when we look at tests, we're looking at the structure, the biomechanics, the nervous system. So we check posture. I was just talking to someone just a bit ago about what we see in the spine now when we take a side view of an x-ray. Normally you have a nice 45-degree curve. This is a little bit more than that, but what happens, what we'll see, majority of people at this point in this day and age have this, text neck, right? This. That puts a lot of pressure on the spinal cord, affects mental impulses going down the cord. So we see that's repetitive microtrauma. Looking at the mechanics, but what we do is we evaluate, we look at posture. If we see this, then we know that there's something off with the structure. We're looking at that. And then we test range of motion. Because again, when you have a vertebral subluxation, irritates the nerve, causes an asymmetrical muscle contraction, guess what? Your range of motion is going to be asymmetrical as well. You may be able to turn more to the right than you are to the left, may have more flexion than you do extension, that kind of thing. So we look at motion. Motion in a joint is vital. Why? Because everything is relying on blood flow in between. So when we look at motion in these joints, in between are the discs, the vertebral discs, which are relying on motion for hydration. So we have to have that motion. What happens to a joint if it doesn't have motion? It starts to dehydrate. So if you think about your discs like sponges, when a sponge is left out on the sink, what happens? It dries out. What does it do when it dries out? Flattens. And then eventually it will start to desiccate. It'll start to flake off, especially if it's an older sponge, right? It starts to break down. That's just what happens. So when we look at an x-ray, what we'll see is that a spinal segment that's fixated, and it has been fixated for a prolonged period of time, it will be aging quicker than the other segments. So when we talk about aging, we're looking at that segment that's not moving, dry out, decay, and degenerate. And we'll see that because we're comparing all 24 vertebrae. We don't always x-ray full spine, but we're looking at the segment above and segment below. And what we'll see is that, again, at that particular segment that's fixated, it's degenerating, it's aging quicker than the other segments. And then when you look at that nerve chart, the first column, and you say, wow, I just saw my x-ray at T2, there's degeneration. I must have had that subluxation or misalignment there for at least 10 to 15 years. Why do I say that? Because that degeneration doesn't happen overnight. This breakdown does not happen overnight. But when you see it, And you look at the chart and you go, wow, that T2 is going to my heart and my lungs. And we look at that, and time again, after seeing that chart, looking at someone's x-rays, they don't even have to tell me what's going on. They'll say, wow, I get arrhythmias. Could that be related? Absolutely. My own husband, who's from a medical background, his dad was one of the chief pulmonologists from Stanford. My husband was a kid. His dad started to breed standard poodles, the dogs. And what happened was my husband developed an allergy to these dogs, and his dad did exactly what a pulmonologist would do. He prescribed him albuterol, asthma inhalers. So 3 times a day from age 10 to age 38 when I met him, he's on an asthma inhaler. And my husband, God bless him, he at the time had the whole image of a lot of people coming out of a medical background that chiropractors were quacks. I was fine with that. So he just needs to be adjusted. So I explained to my husband exactly what I'm explaining to you guys tonight. And I just said, hey, look, this is what's going on. Let's get your spine checked. Sure enough, on an x-ray, we saw that his T2, T3 was pretty substantially subluxated. It took us 2 years of getting him adjusted to get him off his asthma inhaler. Doesn't have asthma to this day. He's 50. He's a lot older now. Anyway, but the thing is that, did I heal him? No. The body heals itself. His innate intelligence was restored by getting the pressure off those nerves, restoring the communication between the brain, the heart, and the lungs. His body on a cellular level was repairing itself like ours is doing right now, right this moment. Regenerating and degenerating and regenerating. But it has to have the intelligence to do that. I have a very simple job. I had a mother bring a baby into me. The baby's name is Josephina. She's 7 weeks old. When the mom brought her into me, Josephina wasn't latching on for a long period of time. So what happened was, mom's breastfeeding, Josephina gets a small amount of milk and then just refused to eat. So the baby's not gaining weight. The mom's freaking out, as any mom would, that her daughter is failing to thrive. So by the time she got to me, I was the last resort. And it happens a lot of times. But the fact of the matter is she had taken her to the pediatrician. The pediatrician had sent her to a pediatric orthodontic specialist. The pediatric orthodontic specialist said that the baby's mouth was not the right fit anatomically for the mom's breast, right? So this is logic. So two frenectomies later, which is removal of tissue. 1 tongue tie. The baby's 7 weeks old when she brings her into me, and the mom is just devastated, right? And not knowing what to do. So I pick up little Josephina, and I start to palpate her spine. I start to feel. What am I feeling for? I'm feeling for motion and symmetry. Remember I said when these bones shift, you have subluxation, it's a fixation of the joint, it's stuck. There's an asymmetrical contraction. I start feeling for symmetry. I get right to her mid-thoracics, T6, T7. That's where those nerves are supplying her stomach and digestive system. Without knowing this, I said to her mom, I said, look, I think that every time she latches on, anytime she gets a little bit of milk, I feel like she's getting reflux. That's what it would be, it feels like for me, and she's out at that T6, T7 area. Mom's eyes just got huge, and she's like, she's on a reflux medication. And I was like, 7 weeks old, 3 surgeries, 1 medication, And a baby that's not thriving, like what is wrong with that? Everything, everything. And so long story short, it was 3 adjustments. And the mom came in after the 3rd adjustment and she's like, she's eating like a horse. I don't know what's going on, so whatever you did. But that's the kind of thing. Again, was it me that healed her? No. I have such a simple job. My job is so simple. It's to find the subluxation, get the motion back in the joint, get the pressure off the nerve, and the body heals itself. What have I seen over the years? I've seen everything, I feel like. I have people who couldn't get pregnant. I've seen many cases of asthma clear up, certainly migraines. We see that. We see, there's constipation. There's so many different things. Again, we don't know. I don't know. If you come and you say, is this going to help? I say, I don't know. Great doctor. I don't know. Maybe. But the thing is that the miracles happen. And I've gotten to witness so many miracles over the years, but I don't know when it's going to be. I'll tell you a quick story about my friend Stu Bittman, because we're going to talk about the spiritual part of this. Stu Bittman is practicing in South Lake Tahoe. He's a good friend of mine. And there's this big, burly truck driver guy that came in to see Stu, and the guy had a shoulder problem. So he comes in, and Stu's not that big, but the guy's like, okay, heard you could fix shoulders, fix my shoulder. So Stu's like, oh, I'll do what I can, and Stu actually was also I don't think he was anyway, he met, was a very spiritual guy. So the guy comes in, shoulder problem, Stu does an adjustment, guy comes back in, Stu does another adjustment. This goes on for a couple weeks. So the guy comes in, he's getting a little bit irritated. He's like, hey, why isn't this working? You're not fixing my shoulder. You said you could help me. So he's starting to get a little bit agitated. And Stu's kind of going like, all right, guy, chill out. And one day the guy comes in with his little daughter. And she's like an 8-year-old little girl. And Stu's like, he's like, I'm just going to ask the daughter. Like, what? He said to the little girl, Stu says to the little girl, he said, hey, I don't know what her name was, but hey, what's changed in your daddy since you've been since he's been coming to see me and getting adjusted? And the little girl, her eyes well up with tears. And she said, my daddy doesn't hit me anymore. And that was just such a moving thing, right? If you think about people, and this guy, of course, was in a lot of pain, right? Pain messes with people's minds. But the thing is that in itself was a miracle. Something shifted in that guy that he no longer felt compelled to carry on that abuse at that time. Something shifted. So what's going to happen? What changes? Who knows? Who knows? But if we're going to talk about a spiritual thing, and we're talking about the body's innate intelligence, and we're talking about if you study, anybody who's studied any meditation or Eastern medicine knows that we're all totally connected. We're all totally connected innately. That means when I change me and I change my consciousness and I change my physiology and I change my energy, it's going to affect you. Most people know. Everybody knows the person that walks in the room just, buzzkill. That's like someone walks in the room with that negative energy and it brings things down. The opposite is true. The opposite is you can also recognize someone who's exuding the energy and the light, right? But in order to do this, you have to have your energy. These things that we talk about, the stress that affects the body, breaks down, creates subluxations, causes pain, people that are suffering, those are lower level vibrations. But what we do through nutrition, through meditation, through getting adjusted, through these lifestyle, these things that you're all studying on a regular basis, that's what shifts. And then, of course, when I shift, you shift, we shift, right? That's the innate intelligence, right? That's the vibe. So if we say, like Gandhi, right? Be the light. That's the thing. Is like, they're in all the great masters, perfect light casts out all darkness, right? If we can either sit back and complain about the state of the union, I'm not going there, right? But the thing is, we could do that, but is that going to increase our vibration? No. But if we change on the inside and we lift up our own consciousness and our own energy, then that's going to make a difference. That does make a difference. It makes a difference individually, it makes a difference collectively. And the more of us that get together and are able to lift that up, that all of a sudden, that changes. That increases the vibration of the planet in my spiritual understanding. Right? So those are the things that we're looking at. Any questions? So I got to get to bed. I got a 10 o'clock. I'm just JKK. But any questions or comments on any of that?
My wife has, excuse me, sciatica pain in her legs, and that must be caused by, look on here, about L2 or L4.
L5.
L5.
L5 sacrum.
L5.
Yeah.
So what's normal course of opening up the self-healing?
How do we approach it? So the question is about sciatica, which sciatica is caused by pressure on a nerve that's coming out of the L5 lumbar region. Those nerves that come out of L5 go down the legs and into the feet. They also go to the bladder and to the uterus, and L4 goes to prostate in males. So at that particular level, the approach to that symptom would be to find the cause. And how we do that is we do a thorough evaluation. So at our office, we do an evaluation and x-rays if necessary. So at that point, she would come in, we look at her posture, her range of motion. We do some orthopedic tests to actually test the sciatic nerve. And then in a particular case of sciatica, I can guarantee that if we took an x-ray, we'd see L4, L5 with some degenerative changes. The question would be how much degeneration is in there. The only way we would know that is by taking an x-ray.
Would the course of treatment be different if it were more or less, or you do the same thing?
That's a wonderful question. I love that question. The longer a condition has been there, the longer it takes us to correct. It's not the
Okay, if the treatment is going to be the same, then why subject the patient to the x-rays, which are not particularly good to have? They have their own side effects.
Yeah.
So if you just say, okay, it's going to be some degeneration of L5, let's go, this is what we do, this is the exercise, and get on with life.
Well, here's the deal, is that we don't know the degree of degeneration.
And why is that necessary?
Well, because the degree of degeneration will determine how long and how much care and what type of care that would actually entail. So if we knew that there was a subluxation at L5, we don't know if that's rotated right, we don't know if it's rotated left.
Oh, you can't palpitate and tell?
You can, but it's not, it's good to have that visual.
Well, we know it's a crutch, but if you were in a place where you didn't have an x-ray machine, what would you do?
That's a great question. I'd adjust her, and I would.
That's precisely what maybe we want to do, like you didn't have an x-ray machine.
Yeah, here's the thing, and we would do that, right? Expecting to see results. That's the thing, is if someone came in, let's say...
Well, not if they don't change their posture and sitting and all the other exercises. It's going to revert back to whatever caused it.
Absolutely. And so here's the deal on that. When we look at it, when we don't take an x-ray, we don't know the degree of degeneration. So I couldn't say, you know what, based on your x-ray, it's been here for probably 15 to 20 years. It's going to take about this long, this much time, this much repetition to retrain the spine, get the pressure off the nerve long enough for it to heal. I can't make that definitive prognosis. However, with that, if we didn't have an x-ray, I was in a place that they didn't have x-ray, what I would do is I would adjust based on what I felt, expecting to see results, meaning that the symptoms go away, the function's improving, or bladder's getting better, whatever. But it does take time. How long it takes, again, depends on how long it's been there. It takes repetition to retrain. So if a bone's been subluxated for a period of time, meaning years, muscles, ligaments, all that want to bring it back out. And then energy and effort's the last thing that you brought up. So what does that mean? That means we change diet. That means we look at posture and how you're sitting. That might mean changing out your pillow, or it might mean changing out your mattress, or simply if you're sleeping on your stomach to sleep on your back. You know, there's a lot of recommendations based on what I'm seeing with that individual. So the x-ray gives us more specificity. That's the bottom line. Now here's another thing. If I was adjusting her and I didn't get results or something, like if nothing changed, that would concern me, right? That would concern me. Is there something else that I need to look at? Yeah.
Thank you.
You're welcome.
When a person has like spinal stenosis, are you able to do an adjustment?
Yeah.
Or does it limit your ability to adjust?
The question is about spinal stenosis, which is a narrowing of the foramen of the spine. Spinal stenosis can happen either here due to calcification or degenerative changes happening that actually close down the foramen, or it can be central canal stenosis, which is coming out the center of the spinal canal. Depending on what type of stenosis would determine how we would adjust. Most often we would adjust. We wouldn't change the fact that calcification that's gone into the joint has degenerated, because by the time that happens, it was stenosis, it's been there for many years. But that we won't change the physical structure of that joint per se. But again, depending on where it's at, we can adjust around it and use special instruments to work with it at that level. Yeah.
What causes kyphosis and scoliosis, and what do you do if the spine becomes fused?
That's a loaded question. Okay, what causes kyphosis? Kyphosis is, oftentimes what will happen is there's going to be a straightening of the curve and then the rounding of the shoulders. There is genetic components. It's exacerbated by lifestyle, working at the computer, having contracted pectoral muscles, that creating the rounded shoulders, a weakening of the rhomboids, deltoids, posterior trap. So these muscles become more contracted, these become more stretched. Scoliosis is oftentimes genetic. There's functional and structural. And what was your third question?
I mean, I'm told, some people say that the spine becomes eventually...
Oh, fused. Yeah. Okay, so here's what's that? Okay, so what happens with kyphosis, which is this, scoliosis, which is an S-shaped curve, and fusion. So in spinal fusion, so remember I said a fixation of the joint leads to a drying out of the disc, drying out of the cartilage. Well, if that is a progressive degenerative condition, so if left uncorrected over time, the degree of the degeneration will continue. And what that means is eventually it will go towards fusion. we can't, if it's fused, it's fused, right? That means that's bone on bone. There's not a lot we can do with that particular segment. We can adjust around it. We can adjust the segments above and below to keep motion in those joints so that they don't become fused. So again, remember I said we have a fixation, dehydration, degeneration, eventual fusion is the natural progress. If we stop it soon enough, we get motion back in, it increases hydration to the disc, and now we start to get more nutrients to that area. It depending on the degree. Again, when I see an x-ray, I can give a better idea, but depending on the degree will determine the outcome. If it's not too far gone, we'll start to reverse it. They told us back in chiropractic college 25 years ago that once that disc it starts to dry out, you're not going to get it back. But we've seen studies on that nowadays. We know that when we start to rehydrate the disc, we'll start to get an increase in the disc height depending on the degree. Again, too far gone is too far gone, right? But if we can catch it sooner, then it's a lot easier. That's what we're going for. I'm not going to say never, but I'm going to say it's very, 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 very rare for me to see multiple segments fused, like at L1 through L5, unless it was a surgical fusion or something like a dish. It's more complicated, but it's not common. It's not common that everything's fused. We want to work with what we have. Oh, sorry. I'm sorry. Go ahead.
Yeah, sorry, I had a little bit of an off-topic question, but since you were talking about sciatica, I remember when I was a kid, I had this observation what blew me away. My grandpa used to be this very, very strong dude, very tough. He had sciatica that led him in bed for weeks. He couldn't get up. And then some guy came to my house and performed him acupuncture in his ear, and within a day or like hours, he was walking again. And do you know anything about what?
Your grandpa was ahead of his time, because a lot of times people were getting a lot of back surgery back then. So the thing is, I am not an acupuncturist, right? But I do know that the body heals. And I think that I'm not exactly sure the mechanism, as far as what happened, but he rebalanced the system in some way. Rebalances chi, the body healed itself. I don't know about that, yeah. But yeah, well, the guy was probably a healer. Yeah.
Yeah, that was.
Mm-hmm.
Last question.
I appreciate how candid you are as a doctor saying that you don't know what's going to happen. So I guess my question in terms of exploring seeing a chiropractor was not so much afraid that the condition is not going to get better, but what if the condition gets worse through the adjustment process or new symptoms come from that adjustment? So it's just that threshold of fear from someone who is going to a different modality from traditional medicine going into chiropractic.
Yeah, that's a great question. There's a lot of fear around chiropractic, and some of it has to do with the movies where like someone's getting their neck cracked, and there's a lot of fear around it. I tell people after an adjustment, one of three things happens. One is you feel no change, which is the least common. 2, you may have soreness, or 3, you can feel a whole lot better. The challenge we have, and I'm going to tell you other things that happen, but the challenge that we have is that if someone has been in a spinal pattern for a number of years, and we go and we do an adjustment, and we do a gentle adjustment, and again, my job is just to get the motion back into the joint, get the pressure off the nerve. Your body, your muscles, your ligaments, everything around that is used to having those segments in a certain pattern. So think about braces on teeth. Sometimes people can be sore, like if it's a big adjustment and you're putting things back in place, that in that case sometimes happens, we'll recommend ice. But that's only in the beginning. As you progress, everything gets better. Sometimes other symptoms come up. Let me tell you this story. One of my very first receptionists suffered terribly with migraine headaches. And what happened with her after her very first adjustment, and she wasn't experiencing a headache in the moment, after her very first adjustment, which is up here, C1, C2, she went and threw up. And it could be like, well, did that adjustment cause her to throw up? No, what happened was her body went into a healing state. She was so toxic that her body immediately, her innate intelligence immediately just started to cleanse her as part of her healing process, right? It's rare that something like that would happen, but it did. But guess what? She hasn't had migraines for years now, and she's also currently enrolled in chiropractic school. But the thing is like, those things can happen. Is chiropractic safe? That's the last thing. When we put it in perspective, my car insurance is more than my malpractice insurance. It's very safe. Again, it's not me. And of course, I'm not saying like you gotta like just like any other profession, you've got to choose your professional, right? But in reality, is like it's very safe. And in my office, I expect to see results. And when I say results, I mean that you're sleeping better, you're feeling better, you know, things are starting to regulate, the pain goes away. I expect that stuff. Not seeing a change is not an option. Now, does it go like this and all of a sudden you feel miraculous after your first adjustment? Not always. Some people do, you know, but not always. It depends. It's your body. It's your body going into a healing state. A lot of times, symptomatically, it's like all over the place, you know. So you feel, but ultimately, you guys again, the symptoms are in effect. By the time your body goes symptomatic on you, it means that problem's been there for a while. Think about your symptoms as your oil light in your car, or your or your electric light in your Tesla. You know, I think it's like at that point, you're not going to put duct tape over it. So that we're not looking at treating symptoms. Just last thing on the back of that sheet, on the last page, there are symptoms. If you're having any symptoms or you're having any loved ones that have symptoms, they want to get an evaluation. That's on us tonight. So if you want to just fill out that sheet, the bottom there are times that if you want to make an appointment. We'll turn that into our office staff. They'll give you a call, and you can, have your spines checked, and that includes an examination and X-rays if you needed them. Yeah.
Okay, let's give a round of applause for Dr. Kiser.